So the first one will just be an overview of the skeletal system, where we kind of divide the skeleton into the axial and appendicular parts of the skeleton. The axial skeleton includes all the structures listed on the left. So your axial skeleton are all of the bones within the axis of the body. Your skull bones, the mandible, which is your jawbone, the hyoid bone surrounds your larynx. The sternum is your breastbone, the rib cage, the vertebral column makes up your spine, the sacrum and coccyx is your tailbone. So these are all the bones in the axial skeleton. And again, so these are all the central bones kind of within the axis of the body. The appendicular skeleton includes all of these bones. So your clavicle is your collarbone, you can feel that. Your scapula is your shoulder blade. Your humerus is the upper arm bone. The radius and ulna are parallel to each other. They crisscross each other when you cross your forearms to the front and the back. So that's your radius and ulna in the lower arm. The pelvic bone is made up of actually 3 different bones that are fused together. And the pelvic bone is your hip bone where your femur will attach. Here's your femur. Within your wrist, you have carpal bones, and then you have metacarpal bones are in the palms of your hand, and the phalange bones are your digits. And you have different phalange bones because you notice your finger can bend in different joints. Then you have your femur, which is the largest bone in the body. The patella is your kneecap. Your fibula and tibia are parallel to each other in the same way that your radius and ulna are. So your fibula and tibia are in the lower leg, and then you have tarsal bones are your ankle bones. Metatarsal bones are in the sole of your foot, and then you have phalangeal bones in the digits of your toes. And again, there's so many because your toes will bend, so each kind of bending is a different bone. So again, your appendicular skeleton are all of your appendages. Yes, it's recorded, Larry, if you're in a lot of pain. Thanks for, yep. And then your axial skeleton, again, is all of the bones within the central part of the body. After we get through this kind of intro to the skeletal system, we'll talk about your axial skeleton. So if we look at your bones underneath a microscope, the histological or tissue classification, bones are classified as either compact or spongy bone based on their histology. Compact bone is more dense in nature, and they will have repeating units known as osteons or the effersion system. So osteon is just the unit of compact bone. Spongy bone consists of small trabeculae or small beams or finger-like projections. Spongy bones will have spaces in it, much like a sponge, and spongy bone does not have osteons. But what the model you have shown here is a model similar that we would have in lab to look at. And it's showing compact bone, and we kind of zoom in on one osteon, which is one unit of compact bone. It has these rings around a central canal or haversian canal. So here's the central canal. The central canal contains all the blood vessels and nerves that run through the osteon. Lacunae or lacuna are small pits that are occupied by a single mature bone cell. Remember, site means cell, and osteo, that suffix has to do with bone. So osteocyte means bone cell. And osteocytes kind of hang out or reside in these small pits called lacunae. And a lacuna for singular. Brian, I'm just referring to this PowerPoint. Can you guys see the PowerPoint in front of me? In front of you?
Yes.
Okay.
Yeah.
Can you, yeah, I'll try to move my cursor over exactly what I'm referring to.
No, I didn't know if they were part of the lab PowerPoints or not. I couldn't find this image in the lab PowerPoints.
Oh, yeah, this is the lab PowerPoint exercise 6 lab that should be uploaded to Canvas.
Oh, that's what we just uploaded recently, right?
Yes, I just uploaded it recently, yeah.
Okay, as I was.
Okay. Yeah, so here is the central canal, and then the osteocytes will be within the lacuna, which are the spaces. It's kind of hard to see here, but you'll see little canaliculi, which almost, they look like little spider legs coming off of the lacuna and osteocyte. A cannuliculus, they are radiating from each lacuna, and they help the osteocytes, they interconnect the osteocytes or the lacuna together so that the osteocytes can communicate. So you see, also you see lamella, which are these kind of circular rings of bones that surround the central canal. You see the osteocytes, which are darker, they're in the lacuna, the spaces, and the canaliculi's or cannuliculus, those are the radiating lines coming off of each lacuna. And again, they allow for communication between the osteocytes, between those bone cells. So this is a look at compact bone. Let's take, oh, and this is an even better picture. I should have been describing the same things I just was talking about with this picture. So here's a great view of the central canal. You can see the blood vessels and the nerve. Here are the lamella, which are the circular or rings of bone that surround the central canal. The lacuna is the space that the osteocyte sits in. So here's your osteocyte in black, and you can see an empty lacuna labeled. And again, the cannuliculus is singular, canaliculi is plural, but these are just the radiating pieces that will connect the lacuna together so that your osteocytes can communicate with each other. Why do they need to know how to communicate? If there's bone stress or bone damage, these cells need to be able to communicate with each other. And it also allows nutrients to be delivered to the osteocytes.
Hey, Professor, is there a layer maximum for the bone, or does it work like a tree kind of in a way?
Say a layer maximum. Can you say that again?
So like in the tree, when you cut it, you can count the little lines. You can tell how old the tree is.
Yeah.
Can you do that on the bone?
Yeah, so similar. So bone either grows apositionally, which is in the diameter, so it grows out diameter-wise, or it grows lengthwise. But keep in mind here, so it kind of works in the same way, Ray, but just keep in mind that what we're looking at is just one osteon. So let me go back in this picture. So each osteon has a ring structure to it. So the bone growth itself usually happens apositionally in diameter, where it will all grow as a unit. But yeah, similarly to that, these lamella will be growing. But it's not quite like a tree where you just have one tree ring. In bone, you have all these little osteons throughout it.
Okay, thank you.
Mm-hmm. But yeah, it does look like the rings from a tree. Let me see here. I just want to talk about a little more structures in this view of compact bone. And you can see the spongy bone is this labeled part where you'll see spaces within it. You'll have bone marrow on the other side of that where your lipids will be stored. You also have what we call these perforating canals. These are also known as Volkmann's canals. They also, if we look here kind of on the side of this model, you can see the central canals travel parallel, and they travel parallel with the osteon. The perforating or Volkmann's canals travel perpendicular to all those central canals, and the perforating canals connect all the central canals together. So again, remember, we'll learn on Thursday when we talk about the skeletal system in lecture, but bone is highly vascularized. What does vascularized mean?
Veiny?
Veiny, blood vessels. So that just means that there are blood vessels that travel throughout bone. So the perforating canals have blood vessels within them that will shoot off blood vessels through each central canal and each osteon. I think that's all. This model just shows how the lamella are kind of, if you like take out the lamella and kind of expand it in an osteon. The periosteon is the outermost covering of the bone. So this is periosteon. And the end osteon is the deep covering or innermost covering of that compact bone within the bone itself. Okay. And this is the osteon or the perversion system. Then we'll look at some of the structural classifications of bones. So we classify your bones depending on their structure into if they're a long bone, a flat bone, an irregular bone, or short bones. The long bones are examples of those are your femur, like is shown here, or your humerus. A flat bone, this is your sternum, so your breastbone. Other examples of flat bone, where else do you guys think you have flat bones? Any ideas? Maybe thin or flat bones.
Pelvis.
The pelvis, parts of the pelvis are flat. Yes, I was thinking of one other location.
The tailbone?
The tailbone, the coccyx is more irregularly shaped. It's kind of shaped like a triangle.
Scapula.
Sorry, say that again?
Scapula?
Your scapula is flat. Yes, in areas. Your scapula is flat. What about your skull bones? All your skull bones will be, they won't be necessarily flat, but they'll be very thin and flat in parts. Short bones, the bones of your wrist are considered short bones. And then if we look at the classification of a long bone or the anatomy of a long bone, we divide a long bone into a diaphysis, which is the elongated portion in the middle that travels kind of the length of the long bone. And the epiphysis are the ends of the bones. And if you remember the directional terms proximal and a distal, one end is usually called the proximal epiphysis. That's closer to the point where it attaches to the trunk. And then the distal epiphysis would be the further end, the part of the end of the long bone that's further away from the point of attachment. Bone markings, and this is what all students love. So we're not just going to learn, well, I'm not sure how much we'll get in detail with this class, but a lot of your bones have different markings, which also have names to them. So not only do you learn about the femur, but you learn about all the different ridges, depressions, cavities, and projections on the femur. The body is the main part of a bone. If any bone has a canal or a meatus, that means that there's a passage or a channel-like passage or a hole that usually a nerve or a blood vessel goes through. A condyle, if a bone has a condyle bone marking, this means it has a smooth, round, articulating surface to it, so we call that a condyle. A crest or crista is a prominent ridge. So you have a crest on your hip bone, the iliac crest. A cornu is a horn-shaped process. Your hyoid bone, which surrounds your trachea, has cornu or cornua. A facet is a small articulating face. So if a bone marking has a facet, it's usually a small shiny area or smooth area where another bone connects to it. A fissure is a narrow slit-like opening. Well, you have fissures in your skull in the back of your eye socket. Foramen means hole. So in the skull bones, we'll see lots of foramen, and a foramen just means hole. So these structures, these holes will be named a different foramen depending on what goes through it. A fovea or favia means a slight, a fovea means a small pit. A fossa means a shallow depression. A groove or sulcus is a deep and narrow depression. A linea means a line, or sorry, my cursor is right there, so I can't see, is a very low ridge. A linea or a line is a very low ridge. A margin or border will be an edge. So the scapula, your shoulder blade, will have different borders to it, and that's just the edge of the bone. The head of a bone is the bony protrusion carried on its neck. So we have the head of the humerus, which sits into your scapula to form a ball and socket joint. The femur also has a head that fits into your hip joint. A notch is a depressed margin. A process is anything prominent that sticks out on a bone. So if you can feel kind of where your cheeks are, you feel a bone that goes back to your ear. That's actually called the zygomatic process. We'll learn about that. Any piece of a bone that sticks out. A ramus is an arm-like part of a bone. You have a ramus on your mandible. That helps give you the shape of your jaw. A sinus is a cavity within a bone. So within your skull, you have different spaces or cavities, and they are called sinuses. A spine is a very high ridge. You guys can all feel the spine of your scapula right now on your shoulder blade. That's the spine. A tubercle will be a small bump. A tuberosity is a large bump, and a trochanter is a very large bump. So not only will you guys learn names of bones, but you'll also learn different markings on the bones that are here. And this is just a great slide to review if you're ever wondering, what does the word fossa mean again? Or what does the word fissure or condyle or canal or body? So that kind of takes us through just the intro, but I'm gonna just, any questions on that, and I'm gonna pause and just take us into the virtual lab just to make sure we all know how to get here, and put the link into the chat, because this will be where you can do a lot of studying. So I put that link to the virtual lab in the chat. Again, we'll get through one more PowerPoint today on the axial skeleton, but this virtual lab, if we go into the Anatomy 101, and all of you are familiar with this by now, here's the intro. There's 3 pages to it in exercise 6. And this takes you through labeling some of the bones. And again, if it doesn't go to the right spot, it'll just snap back into place. So you should know all of these bones. Any questions on this? So I'd encourage you guys to work through this. This is a look at the osteon. And then the last are the bone markings on the bone surface, and having a really good understanding of, yeah.
Is there going to be any changes, kind of like what happened last time?
That's a good question. I don't think so. I think this virtual lab is good to go. If there is, I'll let you know. Okay. So with that, other questions? Does someone else talk? Can never know. All right. Give me a second to pull up the other PowerPoint, and we'll start talking about the axial skeleton. Okay. So here's our axial skeleton. So again, what bones are we talking about if we're in the axial skeleton?
Axis.
The axis bone. So we'll talk about your skull, your vertebrae, your rib cage right now. So as we look at the skull, these are all the bones in the skull. And the skull is probably the hardest part of the body. I think most students would agree, part of the skeletal system to learn, because there's so many little holes within the skull that everyone loves. But if we start looking at the cranium bones, and the cranium bones are the bones that surround the brain, we'll start with these flat bones. No problem, Josh. We'll start with the flat bones that surround the cranium. So your frontal bone is the bone that is on the front, surrounds your forehead, not surrounds it, but makes up where your forehead would be. That's your frontal bone. The parietal bone, you have 2 of them. Parietal bones are 1 on each side of the skull. The temporal bone will be the bone where your ear canal will be. And that ear canal is actually called the external auditory canal. So here's your temporal bone. In the back of the skull, you have the occipital bone. And if you feel the back of your skull, you can feel a little bump on your occipital bone. It's not labeled here, but that little bump is called the occipital protuberance. So once you feel that little bump on the back of the skull, you know you're feeling your occipital bone. These cranial bones that surround your cranium, here's the sphenoid bone. The sphenoid bone is a butterfly-shaped bone that sits behind your eyes, but it has a part of it that you can see from the exterior skull as well. All of these cranial bones are fused together and are joined together by what we call sutures. And a suture is a fibrous joint where 2 bones come together. It's a completely immovable joint, which is good that these joints are immovable, so they're very strong. The coronal suture is the suture that goes across kind of in the coronal or frontal section plane. So the coronal suture will border your frontal bone with your 2 parietal bones, 1 on either side of the skull. The squamous suture will border the temporal bone. So it'll be the joining of where your temporal and parietal bone fuse or come together. The lambdoidal suture is in the back of the skull. I was hoping I was going to have the lambdoidal suture is a suture on the back of the skull. It borders the occipital bone. So all of these sutures where your cranial bones come and fuse together, during fetal development, they are not fused together. And these sutures aren't actually formed, and your skull bones don't form together until about 12 months of age. And between spaces, between the bones, are what we call fontanelles or soft spots, where pieces just of lightly tissue or skin cover the brain beneath it. Why are the bones not completely fused together until about 12 months of age in your skull? Growth of the brain, yeah, so the brain still needs to grow. Why else? Does anyone know? So you have these soft spots in a baby's head where their skull bones aren't completely fused together.
So they can squeeze through the birth canal.
Yes, exactly. They need the body. Yep. So the head needs to be able to fit through a 10-centimeter wide opening. So the head will squeeze, and because the skull bones aren't completely fused together yet, it just allows the head to squeeze through the birth canal. So this is why you never want to drop a baby on its head, or really drop a baby or child ever, but especially on its head before they're 12 months. So, well, you should never drop a baby on its head. This always comes out wrong when I say this, but never drop a baby on its head before they're 1 year old, because their skull bones haven't completely fused together. They have a soft spot at the top. They also have fontanelles kind of on the sides. So anyway, let's talk more about the skull bones. So those are the,
Professor.
Yep.
Sorry. So for releasing pressure on a grown person on the brain, or liquids or blood or anything, you will say they target that the area
So
for drilling.
So like to release pressure or fluid buildup in the brain?
Yeah.
Are you asking me a surgical question? And I'm not a surgeon, Ray.
But I mean, it would make common sense that target the soft area on the bone.
Well, yeah, so that soft spot on the brain in babies, in developing fetuses, it exists. But in us, we don't have any soft spots at all because our bones have all fused together. So our brains are completely covered with bone.
That's what I was thinking, though. But even though it's fused together, that would be the weakest point, right?
So technically it would be the weakest point, but these joints are actually the strongest joints in the body, and they're completely immovable. So it's like you can't even move them. They're so strong. But yeah, I mean, I guess I don't know where you would target a releasing pressure. We would need a surgeon in here. Good question, Ray. You guys, I need like my doctorate, MD, PhD to teach this class. You guys are asking great questions, and 10 years of surgical experience. But if you're interested in this stuff, go on to med school, be a surgical nurse, be a surgical tech. There's a lot of things, and this is the funnest part of anatomy for me, is learning the bones.
I would love to, but I hate school.
It doesn't seem like you're hating this though, Ray. You're asking lots of good questions. So
yeah, I like the medical part of it and how the body functions, but it's just the schooling itself is just horrible.
I know, you just got to get through it. I know. But it's good if you're interested. Okay. Sorry. There's a lot of things we could talk about the skull. I'll try to get through this so we're not on here till 5 p.m. listening to me talk. So those are the cranial bones that surround the brain. The facial bones are the bones of the face. So the nasal bone is on the bridge of the nose. You have a lacrimal bone, which is on the medial eye socket. In the lacrimal bone, you have a little duct where tears drain down from your eye. The ethmoid bone is a bone that sits kind of right between the eyes, behind the nose. It's a really fragile, small bone. The zygomatic bone is your cheekbone, kind of has shaped like this structure. The temporal bone has what we call a process, but when this temporal bone meets up with the zygomatic bone, we call that the zygomatic arch. The maxilla is the bone around your nose and makes up where your top row of teeth would attach into. The mandible is your jawbone. So the mandible is the only bone of your skull that's detached or connected through a joint. And that joint is right here where it connects to the temporal bone, right at this, it's called the temporal mandibular joint. A condyle, the mandibular condyle, remember a condyle is like a rounded surface. So there's the mandibular condyle, the mandibular notch. The coronoid process is the anterior side of that mandibular notch. Here's the angle of the mandible. That's what you can feel that with your fingers on your jawbone. Here's the mental foramen. So you start to see foramen, which means hole. It's called a mental foramen. Again, nerves or blood vessels travel through these different holes in the brain to provide blood supply or nervous supply to the muscles or skin or tissues superficial to them. The mastoid process is on the temporal bone. It's a bump. You can feel that kind of behind your ear. So I will move on from this slide so lots of fun things to learn here. This describes to you what I just talked about, how many bones of the cranium there are. Keep in mind which bones are paired. And we say a bone is paired if there are two of them. So you have two temporal bones because you have one on each by your ears. You have two parietal bones because they go up the sides of the skull. Every other bone of the cranium is not paired. Then the bones of the face are all paired except for the vomer and the mandible. We'll talk about what the vomer is. So you have two of each of these bones of the face, mainly because you have two sides of the face. And then bones of the middle ear, which I think we'll get to more when we talk about special senses. But you have 6 bones in the middle ear, one on each side. And these are the tiniest bones in the body. When we get to special senses, we'll see this, but if you can think about how big a penny is, all these bones of the middle ear can all fit on a penny. That's how small they are. So those are the smallest bones in the body, and they're in your middle ear. Okay, so frontal view, anterior view of the face. Here's your frontal bone. You can see where the coronal suture would be. That would go across the top of the skull. That will be the joint between your frontal and parietal bones. Here's another foramen, a supraorbital foramen. This foramen, the name of it tells you exactly where it's located. Supra means superior, orbital to the eye socket. So the supraorbital foramen is located right here above the eye socket, and an infraorbital foramen is inferior to the eye socket, and that will be on the maxilla bone. And again, the maxilla bone is this bone that kind of circles around your nose. It's what the top row of teeth attach into. From the eye socket, you can look through the eyes and see the sphenoid bone, and you can also see your ethmoid bone. The lacrimal bone, again, your lacrimal bone makes up the medial side of your eye socket. It has a kind of a duct or a drainage system where your tears will drain after they're made and travel across the eye. The mandible itself is the jawbone, and the mandible, here's the mental foramen, that little hole on the mandible bone. The mandible has a ramus, which is this part of the mandible, an angle, which is the pointed part where the ramus will meet up with the body of the mandible, and the body of the mandible travels, that surrounds the chin, and that will be what the bottom row of teeth attach into. Your zygomatic bone is your cheekbone. Have any of you guys learned this before, or is this completely new? Maybe put in the chat 1 if this is completely new, and 10 is I'm already an expert on this. So again, on a scale of 1 to 10, 1 is completely new, 10 is I'm an expert. So some of you have had some of this. If you don't want to comment, that's okay too. Sounds good, thanks for that. Okay. Any questions so far? Are we going too fast? Okay. You're learning it now in another class. That's good too. Hopefully that'll help. Okay. These are the bones that make up the orbit of the skull. So again, the orbit of the skull will be where the eyeball will sit. The frontal bone, sphenoid bone, it will point directly at it. Here's where the zygomatic bone makes up kind of the lateral side of that orbit. The ethmoid and lacrimal bone make up the medial side, and the maxillary bone makes up kind of the base or the bottom part of that orbit of the skull. All right, so good. Here is the supraorbital foramen, again on the frontal bone, the infraorbital foramen on the maxilla bone. And these dotted lines are pointing out fissures within the skull. There's a supraorbital fissure and an infra or superior and inferior orbital fissure. And again, a fissure, that's some bone marking that means slit. Again, it's important because different structures will travel through these kind of fissures or slits. Okay. So this takes you through the structure of the orbit, what makes up the roof of it, that frontal bone, the different posterior lateral walls, the floor, and the medial wall of the orbit. And again, the orbit is just the space where your eyeball would sit. And these are the bones that make up the different parts of the orbit. If we take a look at kind of a mid-sagittal or medial view of the skull, so if we separate your skull into right and left halves, we can see some of the structures within the nasal cavity, which is shown here. Structures of the nasal septum specifically. So traveling down the middle of your nose is a nasal septum, which is a wall that separates the right from the left nasal cavity. And your nasal septum is made of 3 different things. 2 of them are bones. What makes up the top half of that nasal septum is the perpendicular plate, which is a piece of your ethmoid bone that comes down right the middle of your nose, and it makes up the top half of that septum. The bottom half of that septum is made of your vomer bone. Your vomer bone is a bone by itself, and you only have 1 vomer bone. It's shaped kind of like a plow. If any of you have any farming experience or know what I'm talking about, it kind of has this angled shape to it. So this is the vomer, the bottom half of that nasal septum. And then the septal cartilage is just the cartilage that will make up kind of the front area of this nasal septum wall that again separates out the right from the left nasal cavity. When I'm talking about the nasal cavity, this is just the area above and behind your nose. If you've been tested for COVID, how many of you have been tested for COVID? I was during my labor. They take a Q-tip and put it up through the nasal cavity all the way back to the nasopharynx, which is your throat in the back of the nasal cavity. And that's where they scrape to test for COVID. It's extremely uncomfortable. It makes you cry, but it only lasts for about 6 seconds. I timed it. So that is the nasal cavity. Within the nasal cavity, so once we've removed the nasal septum, and now we're looking at just a lateral wall of the nasal cavity. It has these kind of ridges on that wall called concha, or conchae for plural. And these, you have a superior nasal concha, a middle nasal concha, and then an inferior nasal concha. And these are ridges on the lateral wall of the nasal cavity. Just the ridges help when air comes in to trap anything harmful because of what they're covered with, or they help create some turbulence with the air. But these are the concha. The superior and middle nasal concha are parts of your ethmoid bone, and the inferior nasal concha is its own separate bone. They're covered with mucous membrane so that they can trap anything harmful you might breathe in. And again, if you've been tested for COVID, the long Q-tip goes up and around and scrapes the back part of here, which is your nasopharynx. It's the back part of your throat in your nasal cavity. Then sinuses. So a sinus is any space or cavity within the skull. And the sinuses are named for what bone they are in. So the frontal sinus is a space within the frontal bone, right in the front area. And the sphenoidal sinus is a space within the sphenoid bone. So again, these are just different spaces or cavities within the skull. Doing good so far? Okay. Now to an even funner part. So if we're looking at the base of the skull, which your brain will sit in, the anterior cranial fossa, the middle cranial fossa, and the posterior cranial fossa will hold different parts of your brain. but all the cerebrum. The posterior cranial fossa holds your cerebellum, which is separate from your cerebrum. But this is where your brain sits. So we're looking at the base of the skull here. Within the base of the skull, there's a lot of different structures, holes. So I'd encourage you guys, this is a great picture describing the structures. We'll start in the anterior cranial fossa. You have this little kind of ridge called the crista galli, which sticks up off of the ethmoid bone. It serves as an attachment place for a piece of the brain. And then surrounding the crista galli is what we call a cribriform plate. And the cribriform plate surrounds the crista galli. It has little holes in it called olfactory foramina. The word olfactory has to do with smell. So these tiny holes are where nerves that are coming off of your olfactory nerve will travel down into your nose to pick up smells. What makes up kind of the border between the anterior and middle cranial fossa is this lesser wing of the sphenoid bone. Your sphenoid bone, greater wing is right below that there. And again, the sphenoid bone, if you're studying an atlas, the sphenoid bone looks like a butterfly. The optic canal are holes within the sphenoid canal or sphenoid bone, and this is where your optic nerve goes to attach to the back of your eye. The sella turcica is just a little depression within the sphenoid bone. It's about the size of your pinky. This would be a lot more fun if we were in lab and you could put a pipe cleaner or a toothpick through these holes because you could see how large they are. But the sella turcica is a little depression where your pituitary gland sits, and your pituitary gland secretes a lot of hormones. I'm going to come back to all of these holes in the middle cranial fossa, but in the posterior cranial fossa, we have our largest foramen, or our largest hole, called the foramen magnum. What do you think goes through the foramen magnum?
Your brainstem?
Your brainstem and your spinal cord, yes. So remember, this is big picture here. This is where your brain will sit, and the spinal cord comes off the brain, and it will travel through the foramen magnum. The jugular foramen, I'm going to work my way back up. The jugular foramen is a foramen that's actually formed between the occipital and the temporal bones when they come together. And then if we move up, you have an internal auditory canal hole located there. And then we have a bunch of tiny holes within the middle cranial fossa. And I usually teach these. I have one help for you. I don't know if it'll help, but there's 3 holes in order, and I'm going to focus on them right now. The foramen rotundum is circular in shape. The foramen ovale is shaped like an oval. And then you have the foramen spinosum. And these 3 holes are kind of in a curved line. They're not connected, but they're all kind of in like a C-shaped, in the same like area. And if you can remember ROS, moving from anterior to posterior, you can remember the names of these foramen. The foramen rotundum is R, foramen ovale is in the middle, and foramen spinosum is most posterior. So ROS is just a quick and easy way to remember the name for those 3 foramen. Then you have a carotid canal and the foramen lacerum or lacerum. Questions on these foramen? This is such a bummer. If we were in person, I would be walking around to your tables, pointing. It's just easier to learn these on a model. So I'd encourage you guys to look at an atlas, look at the PowerPoint, do the virtual lab to have a good handle on these holes and foramen. Again, why are we learning this? What's going through these holes? Why is this important? What goes through all these foramen? What goes through any hole or foramen in the body? Blood vessels, nerves, yes, exactly. So different blood vessels and nerves travel through these foramen. Yeah, good. Okay. All right, so this is a look at the anterior cranial fossa, the various structures within it, the middle cranial fossa, the structures that we just went through, and the posterior cranial fossa and selected structures in there. And again, we divided the cranial fossa into anterior, middle, and posterior based on what parts of the brain will sit in them. Okay, so I'm going to keep going. This is a look from the bottom side of the brain. A couple things to look at. You can see a lot of these same holes, but just a different view. So this is if we were looking at the brain from an inferior view. Here's the foramen magnum. Here's our occipital condyles, which is what the brain will sit on. It'll sit on your first vertebrae using these occipital condyles to kind of balance on. Hypoglossal canals, you'll see the jugular foramen, the carotid canal holes. External auditory canals, again, will be associated with that temporal bone. And then here's just another view of what we just looked at, but seeing all these same foramen, but from the bottom side. We're also looking at the roof of your mouth here. You have an incisive fossa, which is a fossa or a hole right behind your incisor teeth, which are your front teeth here. And the hard palate is made up of this palatine process of the maxillary bone and the palatine bone behind it. So this is what makes up the hard palate in the roof of your mouth. Here's the zygomatic arch, which it's hard to see from the bottom, but you guys can feel that arch. If you feel your zygomatic bone and follow it back to your ear, you're touching your zygomatic arch. This is a look at where your vomer is. Again, that makes up the bottom half of your nasal wall, your septum. The mandibular fossa, the fossa is a depression that the head of your mandible will sit in. Then you have a styloid process, which looks like a little, if any of you guys have record players, it looks like the stylus on a record player. It's a little pointed structure. The styloid process is important for different muscle attachments or ligaments attachments. Every process and thing or bone marking on the skull has a purpose. So the mastoid process is located there, and then the occipital condyles are what the brain will balance on as it balances on your first vertebrae. How are we doing? Do we feel lost yet? Just a lot of studying and a lot of practice in the skeleton. After we go through this, we'll just go over the virtual lab a little bit as well to kind of review all of this. And I encourage you to do that on your own. Here is a lateral view and a posterior view of the skull again. And then this specifically talks about the sutures and the bones that form each suture. So again, your coronal suture is formed by your frontal and parietal bones coming together. The lambdoid suture is formed from your parietal bones and occipital bone coming together. So you can see that is in the back of the skull. Here's your lambdoid suture. Your sagittal suture is formed by both parietal bones. So if you're looking at the posterior view of the skull, the parietal bones come together on each side and form the sagittal suture that falls in that sagittal plane. And the squamous suture borders the temporal bone, and it's where your parietal and temporal bone will come together and fuse. So again, sutures are important because they form the fibrous joint around 1 year of age when your skull bones will come together and be fused. This is actually a look at an infant skull when I talked about some of the soft spots, which are known as fontanelles. You have different fontanelles throughout the fetal skull, again, up through 12 months of age. The most prominent or largest is this frontal anterior fontanelle. In some babies, you can kind of see it pulsating through the skin. You have a mastoid fontanelle behind that where that mastoid process would be. You would have a sphenoidal fontanelle, kind of where your temples would be. So these are just different soft spots that haven't been, where the bones haven't fused together completely, just to allow the fetal skull to squeeze through the birth canal during birth. The mandible-specific structures of the mandible are shown here. The mandibular condyle is the place where it will join or sit in that mandibular fossa on the temporal bone. The coronoid process. The mandibular foramen is a hole within the, on the inside view of the mandible. The mandibular foramen, if any of you have had dental work done, the mandibular foramen houses a nerve that will often be anesthetized during dental work to try to numb parts of your mouth for cavities or root canals. So if you have gotten a shot in your mouth, they're shooting up the nerve in that mandibular foramen. Here's the body of the mandible, the mental foramen, the angle of the mandible, and the ramus. Your hyoid bone is also part of the axial skeleton. It's located right above your thyroid cartilage where your larynx or your voice box would be. It has two cornea, which are horn-shaped, and a body for different muscle attachments. Your hyoid bone isn't attached to any other bone. It just kind of floats and is connected to other muscles and ligaments. If the hyoid bone is broken, that usually means a person possibly died of strangulation because the hyoid bone surrounds the voice box. So that is the hyoid bone. Questions? Are you guys still with me? All right. Then we'll get to the vertebra. So we'll kind of end with the vertebra, or actually, no, we still need this is a long PowerPoint, guys. I'll try to stop telling so many stories. The vertebra are all of the irregularly shaped bones that make up your spine. You have a cervical region, which contains 7 cervical vertebrae, a thoracic region, which contains 12 thoracic vertebrae connecting to 12 ribs, a lumbar region. Then the sacrum and the coccyx are vertebrae that have been fused together, and your coccyx is your tailbone. The lumbar vertebra will be thicker because they're supporting the majority of your weight. And the thoracic vertebra will also have a specific shape to them, as well as the cervical vertebra. Your first 2 vertebrae are called your atlas and your axis, C1 and C2. You notice you have different curvatures of your spine here, and the different curvatures just allow your spine in proper position, not when you're slouched, but when you're sitting up straight. The curvatures of your spine allow your spine to hold up your body weight so that you're able to walk on 2 feet. Here's a structure of a typical vertebra. Through the vertebral foramen, your spinal cord will go. You have superior articulating and inferior articulating processes, which just connect the vertebra to stack on top of each other nicely. Here's the body of the vertebra where your intervertebral discs will be located. The lamina both the lamina are sides that lead up to the spinous process, and you can feel the spinous process as you run your finger up and down your spine. The pedicles attach the body to the rest of the vertebra, and your transverse processes kind of are parallel or, kind of arms that jut out of the sides of each vertebra. Here's a look at what makes C1 and C2 unique. The atlas is C1. This is what the occipital condyles of your skull we will articulate with. And you'll notice there's no body to C1. Here is C2, the axis. What makes C2 unique is it has this odontoid process, which is like a thumbs up piece of the C2. And that odontoid process, when it's connected with your atlas, has different ligaments that will surround it that allow you to shake your head no. So that gives you kind of that shaking of your head action. You can see many of the same structures in C1 and C2 that are on a typical vertebra, but they might be slightly smaller because they're at the top of the vertebra. Here's structures of a typical cervical vertebra. What makes the cervical vertebra unique is that its spinous process is kind of split or bifid, so we call that split. And the cervical vertebra also has holes, transverse foramen, in its transverse processes. And this allows for blood vessels to travel through. Also, you can see the superior and inferior articulating process with facet. And again, these parts are on all vertebra, and they just allow the vertebra to stack nicely on top of each other. This is structures of a typical thoracic vertebra. One person told me once that a thoracic vertebra looks like a giraffe. If you were looking at it head on, the spinous process is pointed down, kind of like a giraffe's nose, and the transverse processes stick out to the side, kind of like its ears. The body is kind of medium in shape. You can see the articulating processes on the top and bottom, and still the pedicle, which is what attaches the body to the rest of the vertebra. Then the lumbar vertebra will be the thickest in its body. because it has to hold up the body's weight. The spinous process is also kind of wider and sticks straight out and not down anymore. You can still see the superior and inferior articulating process with facet, which will allow the vertebrae to stack on top of each other. So this takes you through the characteristics of each vertebra, kind of what I just explained, and I'll let you guys read through that on your own, but it'll be a great study tool for you as you're learning these vertebrae. Then we get to the rib cage or the thorax. So the bony thorax consists of the ribs. And again, this will be in the location of T1 to T12. So the vertebra T1 to T12 are your thoracic vertebra, and they will each connect to a rib that forms a part of the bony thorax. You have 12 ribs, and the first 7, we say they're true ribs because they will attach directly to the sternum through this cartilage. The false ribs are 8 through 12, and they're called false because they're not directly attached to the sternum. They're attached up through the sternum via a piece of connecting cartilage that takes them up there. You do have 2 ribs that are just floating in your back. Ribs 11 and 12 are false, but they're floating. They're not attached to your sternum at all. Many people break ribs because they're kind of in a vulnerable location. If you're in any contact sports, football, you can't really surgically fix ribs. If there's a cracked ribs, it usually needs to just heal on its own, but it can be very painful if you were in a car accident or in some sort of contact sport and you've broken ribs before. The intercostal space, when you hear the word costal, that has to do with ribs, and inter means between. So this is a space between ribs. The costal cartilage are the pieces of cartilage that connect all of your ribs to the sternum. The sternum is your breastbone. We divide it into 3 sections. The manubrium is the top part of that sternum. The body of the sternum and the manubrium will have a jugular notch. You guys can feel that notch on yourselves in your manubrium. Then the body of the sternum, and then the xiphoid process, normally the place you want to shoot for when you're giving CPR to someone. You feel right below that xiphoid process to perform your chest compressions. In lab, if there's time, I usually show the clip from The Office about the CPR clip. I don't know if any of you guys are familiar with that, but it's like the funniest thing I've seen on television. I don't really like The Office because I think the humor's not very funny, but the CPR clip in The Office, just take a look at it and you'll know what I'm talking about. Would I recommend going to a chiropractor for adjustments of the spine? I would recommend a chiropractor or physical therapists. Chiropractors, there are DO doctors as well, doctor of osteopathic doctors, that learn a lot about the spine and how to adjust it. So depending on what your, I don't know what your ailment is, but yeah, I think chiropractors are really knowledgeable in what they have studied, and they're very knowledgeable in the, I hate to say chiropractor. Yeah, I would recommend chiropractors.
It definitely helps with the structure of your bones. Like, let's say if one of your legs is shorter than the other one because your hips problems or something, and then you constant walk, it's kind of like your transmission in the vehicle, you know.
Yeah.
Just gonna end up screwing up the right side, you know, if your left can produce the same amount.
Yeah, I would, yeah. I don't see anything wrong about going to a chiropractor, as long as they're knowledgeable, and yeah, so I would encourage that. Is there another question that I missed? Yeah, I was gonna say something else, but yeah, definitely. So that, oops, the last, oh, this, I thought this was gonna be part, so this is kind of the end part of your vertebrae, the sacrum and the coccyx. So your sacrum and your coccyx are at below your lumbar vertebrae, and they're also vertebrae that were fused together in development. So you'll see spines to them. You'll see the sacral promontory. This will be where your L5, your 5th lumbar vertebra, will sit right on top of there. Your sacrum will have ala or wings that kind of span out. You'll see the medial sacral crest, which you'll see kind of spinous processes. It'll be a crest. You'll see foramina, which are holes in your sacrum, and then your coccyx is just your tailbone. And the coccyx is just the final fused vertebra at the bottom of your vertebral column.